Welcome to the Dermatology Club's presentation for the 50 and Better Fair of 2021. We apologize that we're not able to provide any skin exams this year, but we're hoping that we will be able to provide you with some information on aging skin that may answer your concerns, any concerns that you are experiencing, or prompt you to schedule a visit with your provider. During this presentation, we will discuss several common skin lesions, both benign and malignant, but as a disclaimer, this is meant to be an informative presentation, and it is not meant to override any medical advice that you receive from your doctor. So our first condition that we are going to talk about is pruritis. It's defined as the unpleasant sensation of the skin that provokes the urge to scratch. Acute itching, which lasts less than 6 weeks, may provide a protective function, but a chronic itch that lasts more than 6 weeks is mostly a nuisance. The prevalence of pruritis increases with age and can be partly caused by a decline in the normal physiological status of the skin. It can be local or generalized with or without a rash, and it can occur anywhere on the body. Cirrhosis is the medical name for dry skin, and by the age of 70, nearly all adults are affected. In fact, cirrhosis is the most common cause of generalized pruritus without a rash in the older adult population. However, pruritis is caused by many things, including drugs. For example, certain blood pressure medications or antibiotics can cause an itch through multiple mechanisms. Additionally, certain inflammatory skin diseases, eczema, cirrhosis, insect bites, burns, scars, irritants, or allergic reactions, just to name a few, can cause pruritis. Although it can be difficult to identify the cause of pruritis, the treatment is fairly straightforward after the origin has been determined. Treatment consists mainly of removing or avoiding the offending agent or allergen in conjunction with the use of a topical or systemic drug. Next, we have ASTEATOTIC eczema. ASTEATOTIC eczema is a dermatological condition that usually begins as dry skin, and as the disease becomes more severe, the skin can crack and cause fissures. These fissures are a result of epidermal water loss. The fissured skin is in a polygonal pattern, as you can see here. These lesions can appear as red, dry, flaky patches that are local or generalized and are more common on the lower legs, as well as the thighs, the chest, and the arms. It's a common condition that affects mostly older adults in dry, cold climates. The early recognition can lead to treatment and avoidance of secondary lesions and infections. It's diagnosed clinically, and skin hydration is the primary treatment for ASTEATOTIC eczema. Short, cool showers with a mild, fragrant-free soap and the use of petroleum-based creams, such as Vaseline or Aquaphor, can be helpful. Next, we have rosacea. Rosacea is a long-term disease that causes redness, reddened skin, and pimples, usually on the face. It can also make the skin thicker and cause eye problems. Rosacea usually causes the face to become red and flushed. And it may look like you may have the redness at the center of your face, including the forehead, the nose, and the cheeks. Women are more likely to get rosacea, especially during menopause, and it presents on the cheeks and the chin, whereas men are more likely to have the symptoms of rosacea on the nasal area, on the nose. Individuals with rosacea may experience bumpy skin or pimples, and the skin can also feel swollen, warm, or even like it's burning. And these symptoms can come and go. There is no cure for rosacea, but treatment can help make your skin look and feel better. Your doctor may suggest antibiotics that you apply directly to your skin or that you take in a pill. Next, we have psoriasis. Psoriasis is another condition of the skin frequently seen in older adults that causes the body to make new skins in days rather than in weeks. It's characterized by red patches with a white scaly surface and can sometimes resemble eczema. These patches are of varying size and often affect the scalp, but can commonly also affect the knees, elbows, and other joints. Some individuals can present with more generalized psoriasis that will affect much of the body. It tends to have a symmetrical distribution, meaning that it can occur on both sides of the body. There's many treatments available, and treatment is individualized for each patient based on other comorbidities that they may be experiencing and the potential adverse effects. But topically applied medications such as corticosteroids are the first-line therapeutic option in older adults. And lastly, I want to mention skin cancer. Older adults are at an increased risk due to a variety of factors, including the cumulative sun exposure from a lifetime in the sun. Skin cancer will usually present as a spot, a freckle, or a mole that is visibly different to the skin surrounding it. And it's often a new spot, but the skin cancer can also present in a pre-existing spot that has changed color, size, or shape. There's several different types of skin cancer, including basal cell carcinoma, squamous cell carcinoma, and malignant melanoma. As these conditions can be life-threatening, if left untreated, early detection is very important. Knowing your A, B, C, D, and E's may help identify when a mole may be cancerous early on. And so A stands for asymmetry, and this is when it may be malignant if half of the mole does not match the other. B stands for border, so you want to see if the edges are irregular, jagged, or blurred. C stands for color. The mole of the color is not always the same, and it can include shades of brown, black, and sometimes the mole can even include some pink, some white, or red coloring. D stands for diameter. The mole is greater than 6 millimeters across, which is about the size of a pencil eraser. And lastly, E stands for evolving. The mole is changing in size, shape, or color. It's important to remember, though, that some cancers do not fit these rules. So if you do notice any new skin changes, please tell your doctor about them. So thank you for taking the time to watch our presentation. Please remember that it was meant to be informative only, and that if you have any concerns regarding anything on your skin, please seek the advice of your healthcare provider. Thank you.
At Des Moines University's Family Medicine Clinic, our goal is to provide you with compassionate care that is comprehensive. From caring for children to the elderly, our medical team provides holistic preventative guidance on how you and your family can maintain a healthy lifestyle and manage any symptoms that may arise so that you can be at your best. During the current COVID-19 pandemic, maintaining your health as well as a safe lifestyle has never been more important. Our providers are here to help when acute conditions affect you or your family. We treat musculoskeletal injuries, infections, illnesses, and many other medical conditions. As an academic medical center, DMU is training tomorrow's healthcare providers on how to provide expert care to people from all backgrounds. We invite you to visit the Family Medicine Clinic at Des Moines University. We offer the care and attention you deserve.